fun. Yeah.
Welcome, everyone, and thanks so much for joining us today for Integrative Medicine Day. I am Dr. Melinda Ring. I'm the Executive Director of the Osher Center for Integrative Health and the Tina Trott Professor of Integrative Health at Northwestern. And I'm joined by my wonderful colleagues today, Dr. Lori Walsh. She is an integrative pediatrician and our Associate Director of Education for the Osher Center, and Dr. Mary Ella Wood, integrative doctor also, and our clinical director for the Osher Center. So today we have this wonderful group of people together. We calling ourselves the Charlie's Angels of integrative medicine. And today, this hour is really for people to ask questions, address concerns, confusing health messages that they may have been hearing on social media or in the news, and even things that may have come up at the doctor's office that may, or their friends are asking. So today, any question can be on the table. We can talk about food as medicine, supplements, different practices, different things that are getting promoted. And the way that we'll do it is we'll start out. I have some questions in mind, and I'm curious to hear you guys, what you guys are thinking about it. And then for anybody who's watching, we encourage you to pop a question into the Q&A section of the webinar, and we'll be sure to get to it as soon as we can. So let's jump in. Anything you guys want to add to that?
No, that all sounds great.
Sounds wonderful. And just this idea that we can share the idea of integrative medicine and integrative health with a group and celebrate the day, that we actually have a day on the calendar, and be able to hear what everyone else is thinking, because we want to do it in a way where we can have dialogue. And we would love to hear what your questions are.
Yeah. I love what you said before. You're like, one day maybe this will be one of those Hallmark holidays, but
right.
Not yet. But today we're gonna treat it like a Hallmark holiday. Anything you want to add in?
I'm just excited to share more about what integrative medicine is, because I think there's a lot of misconceptions about what it is and what it isn't. And so I think hopefully we can get people's questions and maybe debunk some myths or talk about some things that are evidence-based in integrative medicine.
That's right.
So,
Yeah, find that balance there. Well, I thought a good starting point for us, because it is a very hot and somewhat controversial topic, would be the new dietary guidelines for Americans that just came out, about a week or two ago. Mm-hmm. And it literally flipped the pyramid on its head, and was, I think, different from what some, particularly people on the committee that was involved in the advisory group, was expecting to have on that pyramid. So I know I have some thoughts about these 2025 to 2030 dietary guidelines for Americans, but I'd love to hear what you guys think, and especially, Lori, you're coming from the perspective of peds. Like, what is this? How does this new guideline, like what is in there that you think's maybe good or not so good in terms of how we're going to raise the children in our country? And then, Mariella, I know you also are coming from that perspective as a recent mom. So, but Lori, you want to say what your thoughts were when you saw the new guidelines?
Well, I think it really just helps to bring conversation, out there. I think that's really what it's starting, and looking at like what is real food, what is processed food, what should we be eating, how should we be eating, what are things that are affecting our health that we're not aware of. So I guess it's generating conversation, which is good. I think that it is bringing forward that real food is a good thing.
Yeah.
So that's really where I've focused. I don't know that there's been any drill down into how that would affect kids. I know in the work that I do, we really look to say, why can't, we feed kids vegetables first, and, the whole family eating together, really looking at everybody, the whole family as a whole in eating. So I'm not sure how that will...
How it'll play out.
How it'll play out,
Yeah.
I think we're all trying to digest it right now.
Literally. So I'm hearing you think good that there's this focus on real food, the move away from particularly the ultra-processed food that's led to so much of the epidemic of obesity, even in kids.
That's
really
right.
sad.
That's
really
exactly
sad.
right, yeah.
And Marielle, what were your thoughts when you saw the guidelines?
Yeah, I agree with everything you said too. And I think the whole thing about avoiding processed foods, focusing on whole foods is one of the core things of many of these diets, fads that have been changing throughout the years. But it really comes back to like if you eat whole foods, like actually vegetables, fruits, different types of proteins, it always comes back to be the best. And I think these guidelines are starting to reflect that.
Yeah, so I think what you guys are pointing out is who cannot agree with that? Like, just eat the real food, right? That I don't think is one of the controversial things that came up in these guidelines.
Right.
Okay,
Right.
So we're all in agreement there. I think what perhaps is causing more of the debate is this more meat forward, whole fat dairy kind of approach, the way that the pyramid showed up. First thing you look at is, you see, I think it's like
chicken. It's a giant chicken.
Or a cow, something up there in the top left-hand corner. And this is a real different shift from where I feel like the conversation in our country's been going about being not vegan, but, plant forward. And so this idea about bringing, particularly red meat back onto the table in a prominent way, beef tallow being a source of fat.
Right.
Any thoughts about those sorts of things and how they, in your mind, are going to fit into the conversation that you have with patients who come in?
Yeah. I think it's so confusing for patients. So I work in a childhood obesity clinic and work with a preventive cardiologist, and my goodness, we wouldn't recommend that for anyone because we know those lead to heart disease. So it's confusing, but I've been a pediatrician long enough to know that a lot of the food pyramids have been confusing. And I put them up in my office. And the bottom was, eat 13 grains, and, it went up from there. And so I don't know if we've done a good job as a country of giving a visual on what that would look like. So I think it's confusing. I think even the pyramid, I noticed, like, fruit is in one spot and then bananas are lower. Like, are we rating them now? And so that's confusing. Is a banana bad or is it good? And so I think that's a confusing visual. And then, we're going to dig into what the guidelines say. But how many people are going to do that? They might just look at it, right? Because that's what I do for other parts that I'm not spending my time devoted to studying. So I think that is very confusing.
Yeah.
And I think in integrative, what we do is we look at all the different ways of eating, and we understand, okay, why is paleo this? What is that? And what are the benefits of those ways of eating, and what are the things you might be missing when you do it that way, or what's sustainable or not sustainable? So to me, like, the conversation is just too stilted, and it doesn't allow for an easy thing for most people to look at and understand.
Yeah, I agree with that. I think still the plate, and especially the Harvard plate,
Yes.
I think it's a much simpler visual. Like, we don't eat in pyramids. We don't eat in pyramids, and we don't eat in upside down pyramids.
Right.
We put things on a plate.
Yeah.
And so being able to really visualize, like, okay, we need these vegetables, this protein, et cetera, on the plate, I think it's a much clearer message.
Yes.
And so I thought that was a bit of a step back in this.
Mm-hmm.
And in terms of, how much is this going to impact real world, like, nutrition? My major concern is around the fact that things like school, public schools and other sorts of things, the foods and the way that they choose their meals and plan the meals is based on this food pyramid.
Yes.
And so it'll be interesting to see. I'm not saying that people need to avoid red meat or beef or other sorts of things. I just still think that the preponderance of evidence is that too much red meat is not good for the heart. That is my personal opinion. Any other thoughts on that before we move into something else?
Yeah, my other thought too is I think it depends on the population too.
Yeah.
So like pregnancy and breastfeeding, I think are actually great opportunities to incorporate more meats into your diet because it's a great way to get all of the nutrients plus protein, and your just nutrient demands are a lot higher during those stages. I think choosing the right proteins is definitely important because we do know that excessive red meat, especially fatty cuts of meat, does increase your risk for colon cancer and heart disease. But I think there are times and places where meat can be good. And so I personally, never tell patients like, oh, you should eat meat or you shouldn't eat meat. But I think it's important to think about the time of life as well in different situations too.
Mm-hmm. Okay, great. All right, well, we have a question about how can the average person, a non-healthcare provider or non-researcher, implement integrative medicine principles into their everyday life? Any thoughts on that?
Yeah, I think, everyday life, I'm not, so they said non-healthcare professional. So I think focusing on lifestyle medicine. So lifestyle medicine is its own thing. It's its own specialty, I guess you could say, but it's the core principles of what we do in integrative medicine. So focusing on things like nutrition, exercise, sleep, social connection, and stress reduction really are the foundation of everything we do in integrative medicine before supplements, before all these fancy treatments that people are wanting. I think just going back to the basics.
Yeah, great.
Yeah, I would agree. I have I have that wheel in my office, and I show people because I say this is how we're going to anchor health. This is what I do, and some of it is like circadian rhythm and sleep and rest. Sometimes we're just over aroused, like we can't calm down, or food as nourishment. So even using different language. And then, it feels a little bit like whack-a-mole some days. We don't all walk around like, hey, it's a perfect day. It's like, ooh, okay, what's happening at my phase of life? What's happening now that something has happened to me that I need to put more attention into one of these areas? And in integrative, we extend out to spirituality, this idea of mind-body, but it doesn't mean you have to meditate necessarily. It's a really very actionable ways that you can learn how to calm your nervous system, and that's what I love about integrative, is that expansiveness of it and this other way of understanding and using the plants or, supplements can be helpful, or even routines like the sauna is one of my favorites, right?
Oh,
so,
yeah, you and your sauna
I love
on Lake
sauna.
Michigan. Oh,
I know, right in there. Not today,
Hopefully
though.
not today when it's negative 23
I'm
degrees.
not insane. So that's what I love about using that same wheel, the integrative lifestyle wheel, to help people visualize in a very nice way, actually. It's a good example of a nice circle.
Yeah. Yeah, I think you both bring up this idea that is so critical because people, think about like, and I remember the studies when they came out in the 1990s about who's using integrative medicine. And it was surveys of very specific populations, really. And so it ended up, like at that point, being like, well, the yuppies are using it, the people who are highly educated, who have a lot of disposable income, et cetera. And to me, that moves away from what I think all of us believe integrative medicine is, because integrative medicine is for everybody. Yes, we have like some cool new, and it's continually new wearable tech you can do. There's like extensive tests you can do, functional medicine tests, whole body MRIs, all this stuff. You don't need any of that to do probably 98, 99% of health promotion is the food you eat, the people, the way that you nourish relationships and your soul and your spirit. Movement is so important. Avoiding harmful substances, all these kinds of things. So I think that's, in terms of where do you start with that, you start one step at a time. It's every little thing actually makes a difference. Back to we got a few more diet questions here. So there's a question about debate about seed oils and inflammation. Is there good evidence that they are harmful? So I know that I have my own opinions about this. I don't know if you want me to take it. If you guys, what do you talk to people about?
I would like to hear what you have to say. Yes, I would.
Okay. So what are seed oils? So seed oils, we're talking about things like canola oil, soy, safflower, all of those kinds of oils. And there is a lot, I see it on social media all the time, about don't eat seed oils, don't eat seed oils. And, the most recent evidence like this, there's a 2025 analysis that showed that these seed oils overall do not increase inflammation in the body. Right. And in fact, when you compare replacing other more harmful fats with these seed oils, it is still beneficial. Now, number one, in terms of all the research, is olive oil. So if you can do olive oil, that's going to be your best bet. However, using in small quantities these seed oils, if you're going to stir fry in a little seed oil, canola oil, or whatever, it's not going to create some inflammatory storm in you. Mm-hmm. And the other thing is that, when we look at these oils and the seed oils, there's a big difference between going and getting fried food that, like the French fries that are in a vat of oil that keeps getting heated and heated and heated and creates these volatile chemicals. That's very different than I'm making this, veggie and chicken stir fry with a little bit of oil in my pan. Like, that's a very different situation. So we have to look at the whole package of what's happening with that seed oil. And then there's also, there's different ways of processing. So you may see, for example, some of the oils that you can get are labeled as high oleic, OLEIC oils. And those have actually been formulated to be rich in these antioxidant compounds. So that's an even better way to do it. You have to be a little careful with high heat with some of those oils. Mm-hmm. But generally, my feeling is olive oil first, best thing you can use, and according to the studies. I even had a patient who was told by a dementia center to start adding in 1 to 2 tablespoons of olive oil for dementia prevention. So, this has some big benefits here.
And cooked and uncooked, right?
Right,
like
exactly.
Little drizzle on the top.
Yeah. So that's the best, but don't be terrified of cooking with some of these oils. Just don't get them in the fried food kind of format. Stay away from the Kentucky Fried Chicken in the big vats of oil. No, I won't have a sponsorship from them. Okay.
Well, I want to tell a story about my dad, who's about to turn 89, told me when because it was the wartime, and he had to collect the lard from all the houses in downtown Philly to make soap. So everybody had these big cans of lard, and I remember that, when they do the bake, there would be, and you look at that, now you think, that is what is in my artery. So that was a different time, margarine and so forth. So the idea that we have these options is great. It's creating confusion, as it could. Yeah. But also, I think you also want to look at, make sure you're not keeping your oils too long, and that where you're storing them is also important. So you don't buy... You buy from a good, resource, and that they're stored properly. Because if they have a taste to them, you're like, ooh, that doesn't taste good. Pretty much want to get rid of it. And if
that
it
smell
has
too.
the smell, it has smells like
turpentine
thinner or something. Yeah, don't ignore that, because then it's really not worth your effort. Use a seed oil then if your olive oil smells like that. So.
Yeah. I mean, there's a lot of good things you can get at Costco, but the huge things of oil, if you're going to keep it around and it's still around 5 years later, is probably not the thing for you to be buying.
Right.
All right, so another nutrition question, which is a very big topic, and it relates back to that pyramid because we have protein in that pyramid. And so there's a lot of push for how much protein people need to be eating these days. How are you getting this question, Mariella?
Yeah, a lot, yeah.
Yeah, so we'll talk about that a little bit.
I mean, I think it's different for everyone. I think it depends on how much exercise you're doing, too, because you're definitely going to have more protein needs then. My rule of thumb in general, it's going to depend on the person, is to try to get 20 to 30 grams per meal if you can. But, of course, it's going to depend on, if you're trying to get pregnant, that's a different story. You're going to need more proteins and healthy fats. If you're training for a marathon or exercising a lot more, it's going to be higher needs. But 20 to 30 grams is a lot, and most people don't actually get that in their meals. And it can be, it's like 4 to 5 eggs is 20 to 30 grams of protein, and people are maybe eating 1 or 2 eggs with their breakfast. So I think knowing the numbers can really help people look at the different protein contents in different either plant-based proteins or other proteins. But it's a lot more than what people I think are currently consuming.
Yeah, it's interesting because as a country, studies say that we get too much protein. But I think that's very, again, it's interesting because in my practice, and even me, I think I'm more on the other side, because when you start to focus on eating a lot more vegetables and plants and people who are carb cravers, then the protein becomes something you need to consciously work at. I think in certain communities, eating a lot of meat is, either the cultural norm or it's just what they do. So I think it's really variable. So you need to look at not just the amount, but also the quality of the protein and what you're getting too.
Yes.
Yeah. What about for kids? Are you saying, because I see it for adults, do you have parents coming in saying how much protein does my kid need?
Yeah, they might, but it's a lot to think about. As I think about I gotta have 20 grams of it, it's a lot, right?
Yeah.
And so we use the plate for kids and for families, because there's an overwhelm of well, he likes this and she doesn't like that. And I really just love the plate, because if you're thinking about when you're eating something, we call it protein and produce, you're going to always you got to balance. If you want to have this, you got to have that with it. And then we have these great little pairings that make it exciting. And so we really just go back to the plate idea.
Yeah.
But I think that people underestimate, they think, teenage boys think they need more than they do, and then the people as they age don't realize they need more than they're getting. And so it's trying to find the balance and then, bring people back. Once again, I use the plate.
Yeah. I mean, that you bring up an important thing, which is another category. I can think of 2 other categories of people who really need to focus more on protein. And people don't realize that older adults actually need to have more protein.
They do, yeah.
And if you look at the recommended amounts, that once you hit a certain age, and unfortunately I think I'm either at or above that age at this point. I always think it's really weird when I fall into the older adult. What? Older adult?
I know.
I qualify for ARC? But older adults and so many people now on GLP-1s.
Yes.
And the GLP-1 medications, I think they are incredibly helpful. I've told patients, to me, I've not seen anything in my lifetime, in my medical career, that has had the same efficacy for weight loss compared to these GLP-1s, but they are currently associated with a risk of muscle mass loss. And so I think that's one of those areas where really being conscious and tracking, with one of the free apps, can be really helpful.
Right.
Yeah.
I think sometimes people, there's different kinds of people. Some people forget to eat. The forget to eaters.
Yeah, exactly.
They sometimes need whatever it is that helps them remember, the plate reminds them, or something visual. But everybody has a different relationship to food. And then when the GLP-1s, the food noise goes away and they're not hungry. And so relearning, okay, here's how I need to nourish myself. It might be a smaller volume, but I'm going to try to get a little bit of everything, in that smaller volume.
Yeah, I know. Losing weight but being undernourished is not a good thing. You have to maintain nourishment for sure.
Yep, definitely. Because you are more, with any weight loss, but specifically with the GLP-1, since it's faster, you're more likely to lose muscle before fat. Yeah. So the protein goes back to the protein, but also strength training. I always recommend people who are on a GLP-1 strength train, or else you're going to lose that muscle before you lose the fat.
Yeah. Do you have a recommendation for how you tell people? I know you're a yogi yourself,
yes.
which is you're going to lead us in some yoga. Yeah. If we run out of questions, if we run out of things to talk, we'll all do
a little yoga
pigeon
flow.
pose, downward dog. which is a strength, a form of. Do you consider that like
I
yoga?
do.
Yeah. So let's talk about strength
Training, yeah. So I think certain forms of yoga can be considered strength training, especially hatha yoga, which you are holding the poses longer. There's faster vinyasa flows, which I think would fall more into cardio, but you're still getting some strength training with it. I think Pilates, too, is an underrated form of actual strength training, especially reformer Pilates. It's definitely strength training. You're definitely using your muscles there. But my rule of thumb, especially if you're on a GLP-1, work up. So if you're not currently strength training, definitely don't start with this. But aim for 2 to 3 times a week of actual strength training. So whether that be hatha yoga, Pilates, actually lifting weights if you're doing it safely, I think is a good rule of thumb with the protein content if you're trying to lose weight, or especially if you're on a GLP-1. Yeah.
How about you? You have any exercise recommendations?
I think just what you said there, and then seeing what people like. Like, are you a swimmer? What's accessible to you? What is somebody else doing? But I do think also, when you bring up exercise, I think it also calms the mind. There's a lot of data on that.
Oh, yeah.
And that's the other part, that when you're making such a life change like this and you've got this medication that's really helping you and maybe reducing noise, how do you begin to then regulate your own nervous system even? Like the value of that, or if there's a community that you join. Like there's so much that comes from that ability to take a step in another direction. And that's once again on that little wheel,
Yeah,
So,
well, right, and like you just made me think of dancing. Like I love dancing. I don't even think of it as exercise.
Yes.
But, what a great way to move.
It's movement, right?
Yeah. So when it comes, we have a question here, and it's also a common one I get, which is what about creatine? What about other supplements? Could be protein supplements, other workout supplements. Are these powders and performance aids actually beneficial and safe?
Ooh, yeah.
Any thoughts?
Yeah, so I think creatine is actually one of the most well-studied supplements that we have. Surprisingly, it's definitely was used first in the sports spaces, but there actually is quite a lot of evidence supporting that it can help increase muscle mass if taken before workouts. There's all this news out there about the cognitive benefits, and I think there's emerging evidence, but it's not complete right now. And so I currently don't recommend starting it just for the cognitive benefits, just because we don't know. It may be helpful, but we do know that it does help with muscle mass and performance. Generally safe if you have kidney conditions, if you're pregnant. There's always conditions where you want to watch out for. So always talk to your doctor before taking any supplements. But I think it's generally safe.
Yeah, I'd agree with that. Yeah, and the typical dose you read is 5 grams of this powder, of a good quality. Quality makes a difference. Maybe we'll talk about that next. A good quality powder, either within an hour or so before or after exercise. I know some people use it on a daily basis. I've seen studies for improving cognition, attention in both young adults, like in their 20s, and then also in menopausal women and older. So, I think, particularly for like my midlife women who are dealing with menofog plus losing muscle around the time of menopause, I'm always like, I think creatine's a pretty good one, actually. Yeah. I know I added in.
Yeah, and from the pediatrics standpoint, there are, sorry, teenage boys, but some of the creatine supplements are contaminated, right?
Yes.
And we don't always ask in medicine because we don't know, and it's not picked up on. And then there's side effects, and some of the side effects they present with like hyperkalemia, and we don't know in ERs to be looking for that. So it's this kind of subtle kind of thing that we need to be more educated within medicine, and I think that's what we do in Integrative, is teach our colleagues or offer these other opportunities so that we can be aware of what's going on and educate our patients about, this is a good idea, but here's where you have to get a good supplement so that you're not harming yourself.
Yeah, exactly. Well, before we move on to that idea about how do you pick a good supplement, any other things that you'd like to recommend for people when they're working out? Do you like protein powders? Do you have any other favorites? I know I have one other favorite I like.
Ooh, I wonder what it is.
Protein powder, I feel mixed on.
Yeah.
If people want to add it in, sure, great. I think if you can get your protein from, again, whole food sources, I think that's better. You're going to absorb it differently than when you're drinking a protein powder, especially if you're adding it to different forms of milk or non-dairy milk. You have that extra things going on in there. But I think protein with exercise is, going back to the same thing that we've been talking about, is just one of the basics.
And good hydration.
Yeah.
And hydration, definitely.
Yeah. Clean water. Yeah.
Right. Yeah, I also like the data on beet, actually. I think these beets, the way they increase nitric oxide and increase blood flow, like they have some decent evidence too. Now, I do that in a beet juice, fermented beet juice I make at home. I know there's a lot of beet supplements out there, powders and other sorts of things. But for me, beets and creatine is the way to go, and lots of fluids.
Oh, nice. I like putting tofu in the blender now. Tofu is tastes really good. It sounds terrible, but it's really good. And then I love a little tart cherry juice, organic.
Oh, yeah.
Like a little bit of the muscle part, but gives flavor without having to add. And then, of course, berries. And
tart cherry juice has some melatonin.
I know it does, and it has evidence for like post-recovery kind of thing.
Oh, yeah, interesting.
So,
okay, good, yeah.
And that's what that's what I try to do as well, sort of talk about. If people
how you can
are
do it
interested.
through your diet.
Yeah,
make a super smoothie.
it's really good. Yeah, it really is. And then for kids,
have to share that recipe.
turn into
Smoothie.
popsicles, and so kids have a popsicle. It's delicious, and sometimes it looks a funny color if you put anything in there like that's green. But I love collard greens in there because they're really packed with a lot of. Well, there's calcium. There's a lot that we don't get from other. And I never knew what to do with the giant leaf, because I'm like, what? I didn't grow up with this. What am I going to do? So I started to stick it at the bottom of the blender. It's really good, but the color is not always so nice.
Yeah, I hear you.
So I don't care. I just drink it.
Yeah, well, it sounds like a great way to get your electrolytes rather than like some of these electrolyte drinks that are out there. So I would go for that.
Right.
So let's go back to this idea about quality, because I think you're right. What you were saying about the teen athletes and things like that. What's been shown is that there are a few. So in the medical world, I will say in medical training, most health professionals in traditional training get almost no education about dietary supplements. And so many times the default then becomes, if a patient asks them a question, don't take it, it's not safe, it's not FDA regulated. I hear these things all the time. And, and to me, for one, we got to remember medicine started with herbal medicine, from herbs and these things that have been used for thousands of years, since the beginning of medicine, and our current drugs, many of them come from herbal medicine also. So I like them, and also think that the quality makes a huge difference, because there's a few categories, athletic performance being one of them. So sports performance, sexual function, weight loss. These are the three biggest categories that get adulterated with drugs. They found Viagra in it. They found steroids in it. So that's where you need to be really, really careful.
Right.
And other than getting, say, like a pharmaceutical grade supplement and kind of knowing what those brands are, how do you tell people like how to find how do they? If they're not coming to you and saying and you're saying, here, take this supplement. What do you tell them when they're trying to understand how to pick a good supplement?
Yeah, so I think a couple different things. A couple rule of thumbs that I tell people. I usually give very specific recommendations, but if a supplement has a proprietary blend, that's usually a red flag for me, because we don't know how much of each ingredient is in it. If it's not third-party tested, then we don't know if it's been tested for contaminants.
And how do you know if something's been third-party tested?
does the EWD?
No,
they don't do
Consumer Labs
certifications.
does.
Consumer Labs, yeah.
Consumer Labs, Good Housekeeping does
Good
them.
Housekeeping.
USP, sometimes you'll see the label on them.
Dietary supplement. There's some a little bit on there.
They don't do.
Not
They
much.
do reviews, but they don't do testing. But
Natural
if you-
Medicine Database doesn't.
No, they don't
They
do-
more just look at the.
Yeah,
that is a
they'll
great
review the
resource, though.
evidence.
So third-party testing is really important, and no proprietary blends, and then looking at what's actually in the supplement. So if there's a blend of a lot of different things, making sure the dose is not too high or too low, which you can get guidance with a professional. So those are the main top three. If I'm giving a general advice rather than giving a specific supplement recommendation.
Yeah.
But that's a lot to take in. I mean,
It is a lot,
if I go to like Walgreens, I think I'm going to look for something. I get overwhelmed, and so it's very hard. I think to take that all in. I think we all, need guidance, and that's what we learn in the fellowship is this idea of how to begin to find good brands that you can rely on that brand. It's been vetted, that the company is, and so there's clearinghouses for that we send people to, and then they can look for what they want.
Yeah.
I will talk to people about local health food stores that are high quality. I love supporting local places that I know this person is really well trained. They bring great products in, and it's not the standard like ones all over the country. It's really the local, and so that could be another good source. And then sometimes people, they bring the whole bag in, and we begin to go through. And a lot of the time, it would take a couple visits actually to go through some of them, because it's a lot. And it's complex because you're thinking about the person, what other medication are you on, why are you taking this, can we turn it into a food, So that's ultimately the thinking process. So it's a lot of fun, but it takes time, and there's an expertise that I think we learn in Integrative of how to do that.
Right. Yeah, so for people who are might be listening, I agree. Like if you can work with an integrative medicine fellowship trained physician, or functional medicine, or a naturopathic doctor, somebody who really has extensive training in understanding not just understanding dietary supplements, but understanding dietary supplements in the context of the individual person.
Right.
Like, I think that's so important. And always a plus if you have access to it.
And we think of supplements as allies, not as like the thing,
Right.
I think that's a little bit of the westernized way of looking at even the herbs. Ashwagandha, well, we want to, is it the right herb for you? And how long should you take it? And, that's really what we learn when we learn about these plants or even the supplements as literally a supplement to a bigger picture, or what might be missing because of medication you're taking, or because you're aging and maybe you don't absorb as well, or you have a certain condition. They're targeted ways to benefit, but they're not really just thrown in willy-nilly.
That's right. They're a supplement.
They're
not the,
a supplement,
as you said, they're not the core.
And I think we all probably go through I think I'll try that as we go through the fellowship, and then I'm like, okay, that's enough. But there's a part where we do experiment on ourselves, I'm sure, with all these things.
No comment.
No comment. Okay.
But I think to your point, people end up trying to switch from a medication to a supplement, thinking that it's a natural form or a natural way of treating their high blood pressure or whatever it may be, but they're just really switching from one substance to another, which I think is another thing to consider as well.
Right.
And then, like you said too, like if we can supplement with food instead of an actual pill, that's always going to be the best thing.
Yeah, I love what you said too, because as an example, I have people who will come in and they'll be like, and even, high cholesterol, maybe already some coronary calcium buildup on some of these now readily available coronary calcium tests, and their doctors are telling them you should be on a statin. We don't want you to have a heart attack. You should be on a statin. They're like, I don't want a statin. I heard it causes dementia. I heard it causes muscle aches. I already am achy, like these sorts of things. Is there a supplement I can take instead? Or my friend told me I should take red yeast rice. And I'm like, red yeast rice is a statin. So if you don't want to take a statin, that's not a good substitute. And if you need a statin, then take the statin. That's my feeling about it.
That's exactly what I say.
Unless you cannot tolerate all the statins and the other medications, if you would benefit from preventing further buildup while we work on other things like, your diet and all of these other things and other supplements, plant sterols, other things to lower cholesterol. Integrative medicine is not anti-medication.
Yes.
Right.
Yeah, I think that is a very important point we have to make here.
Yeah,
it's not anti-medication. It is not anti-vaccine.
Vaccine, no, it's not anti-vaccine, no.
Yeah. So, I think we're still saying these things that we have in conventional medicine that science has shown to help prevent disease, to treat disease, are not things that we want to throw out.
No, I so value my medical training here. I mean, it was so excellent. And if I didn't have that, I wouldn't have a platform to begin to think about other things. And so really the focus is more, how do we build health, but also, help support people in understanding. And sometimes people come in and I'm like, yeah, you need to take everything they said because this is really going to help your health. And just as you said, let's come up with some other ideas. But I think that's where, working with somebody that you trust is important. Yes. And I don't know why that's happening. I don't know if there's more noise out there that makes it harder to know which thing to pay attention to. I certainly understand that. I think I probably felt that way until I entered the world of integrative, where we even have the med students go, should you use Himalayan salt or real salt? Eggs or no eggs? These are good questions. Let's figure out where we're at with it, right? So it's a little confusing, but knowing that people that are trying to live in both worlds. We live in two worlds. We love that world, but we also know, hey, other world, did you know we could help reduce stress of people? A little bit of aromatherapy, and you don't have to use other, Valium on people, right?
Yeah.
That's the word we're trying to also bring into a hospital system to understand there's really cool ways to help people.
Yeah.
In other ways.
Yeah. Okay, great. All right. So, oh boy, here's a biggie. Okay, so this is a shift here. So we've talked about food as medicine. We've talked about some dietary supplements, lifestyle kinds of things. What comprehensive lab panels should I have my doctor run to better understand my metabolic and nutrient status? What gives me the most bang for my buck? So let's talk about testing. Let's talk about testing. Who wants to start here?
I want one of you guys to go.
So I think testing should be very individualized. I think that some lab tests are really important to order, but it really depends on the person. So I will never just give a list of labs that I think everyone should have for their health. I mean, maybe cholesterol every year would be a good idea. But for general metabolic health, I think it really depends. And I think if we order too many tests, it can confuse the picture sometimes, not always. But I think that's why our integrative visits are much longer, so we can actually listen to the patient and find out what tests we need to do. And then there's plenty of tests that we can do in a traditional laboratory setting that's not functional medicine testing that I think can be really helpful. Functional medicine testing I think can be helpful, though I definitely use it. But I think it's more of we've tried other things first. Now let's do a deeper dive, understanding that these tests aren't diagnosing disease like diabetes or high cholesterol. They're giving us patterns. So I think, I can never just give a list of labs that everyone should take. It has to be very individualized.
Yeah, and to be clear, so when we're talking about testing, so we have the labs we can order. You can get through your doctor through Northwestern, through Quest or LabCorp, those labs. And then when we're saying functional medicine tests, for people who don't know, functional medicine overlaps with integrative medicine. It's a little bit different. It's a field that kind of developed on its own and talks about root cause, finding the root cause, and what, that's certainly a part of what I do too. I do functional medicine. I'm trained in functional medicine. But the testing, when we think about it, is saying we can do all of these tests to find the root cause. And that's a very appealing Who wouldn't want that? They're like, if I get to the root. Yeah, of course, we want to get to the root of what's. We don't want to Band-Aid things. We want to get to the root of things. And so then we're talking about tests for inflammation and hormone imbalances, cortisol imbalances, full nutrition profiles, your gut microbiome, your genomics, do you have patterns that indicate you're more likely to have certain things? So, there's really, you could spend thousands and thousands of dollars doing tests. And we have to recognize that the vast majority of these tests are still considered in the experimental phase.
Yes. Yeah.
So I use them. I think some of them have a lot of benefit and some validity around them. And some don't. Like, I think some don't have, I think there are tests that shouldn't be done. I think they can be really expensive for patients. And like you said, they can create information overload. And which, people who are convinced they have, they were told once they had yeast syndrome or have mold toxicity. And now that's kind of become their identity whenever they have a symptom that they relate it back to that. So I think we need to be really cautious when we're doing these tests to put them in the context as you said, like patterns of what's going on, but not they're not diagnosing you with something.
Yes.
Yeah.
Yes.
Yeah. Any other? What do you think about testing? Because kids are different.
Kids are definitely different. We screen for iron deficiency in the first year. Really important to pick that up early, right? That's easy. And we check for lead.
But it should be done later too, I think.
Oh,
I'm sure I was iron deficient when I was a teenager, but now
no, that's where we begin it, and then we keep going. And we really need to be checking lipid panels much earlier than we're doing because we can pick up heart disease and lipid issues much earlier, and that's what we want in our clinic for kids that have an elevated body mass index. We want to see them early because working with preventive cardiologists now, it's like, wow, we really can make an impact and support their heart health while we're making that impact, but they need sometimes a statin, which is shocking.
Yeah,
this is shocking in pediatrics.
Kids.
This is not something we've ever thought about that way. So, screening for those kind of things, like if there's a cross-country runner, always check ferritin. They always are low in ferritin, and they do better.
And what is ferritin?
Ferritin is an acute phase reactant that's a helpful part of the iron, system, and it's a funny
iron
little
storage.
Iron storage, because it's a funny thing, because it's like it means nothing and it means something. In some conditions, like if you've got hair loss or restless legs or these runners. So once again, it's to the patient. I do like vitamin D levels, and we do that a lot in the pediatric obesity clinic because I think there's good data on checking that. And sometimes we'll do a fasting insulin to see, once again, it's not changing what we're doing, but it's giving a sense of where somebody's, ability to manage insulin is and how does it change over time. That's a lot of what we're watching. So pretty much the same. Nothing too out there. I'm not functionally trained, so I refer to people when people need more help.
When they need that. I do like to test because I think there's so many things that just get missed with just doing the sometimes the basics that get done at your annual visit. Usually you get a complete blood count. Comprehensive metabolic panel that looks at your electrolytes and liver, your glucose, and maybe a TSH thyroid test and a lipid panel. Like I feel like that's kind of what I see some people come in. I'm like, okay, that's kind of the bare minimum there. And like you said, like it has to be individualized, but I think markers for metabolic health like hemoglobin A1C, fasting insulin, those I think can be really helpful. Nutrient levels depends on the person because if somebody's on, for example, proton pump inhibitors, we need to be thinking about B12 deficiency and magnesium deficiency. So, we need to be looking at those. And somebody who's on thyroid medicine.
Metformin, too. Their B12 can be depleted.
B12. So the medications make a difference. Birth control. So those may drive nutrient testing in a certain direction. And then there's people who think that, who are treated with something. So we can use, for example, thyroid. And their main measure, that TSH, thyroid stimulating level, looks normal, but they still feel symptomatic. And so in those cases, I'll say, like, well, maybe we need to dig down a little bit deeper and get a full panel. I think, like, like you guys said, like it's really up to the person, and some primaries and specialists will order. And I will say also now we have like the cardiovascular tests, like the ApoB,
of course,
ApoB, lipoprotein A. You know, we've been ordering those for. I've been ordering those for for a decade in integrative medicine.
Did that come from functional medicine? The
it came, it didn't come from it, but I will say that I know that I've been looking at some of these deeper preventive cardiology markers for a really long time, and now they're in the guidelines.
Yes.
So same thing, calprotectin.
Yes.
For
Mm-hmm.
inflammation in the guts.
Right.
Something that started in I saw it in functional medicine.
That's what I'm saying. So this is
ago.
why we all need to be communicating.
Right? And that's why you need to be sort of like Andy Weil always said, who's the father of integrative medicine, so good to acknowledge him today.
Yes. Yes.
Always said, we should have open-minded skepticism.
Yes.
I love that phrase.
Yes.
Yeah. So, and that's true both ways, both for conventional stuff and alternative, integrative, complementary approaches. So I think we're going to run short on time. Let's see what else we have here. Well, this seems like a good one to start to end on, which is since we've talked about food, we've talked about supplements, we've talked about now testing. Maybe we can focus on this, like the role of community, relationships, all of that as being part of the fabric in one's health. So what do you guys think about that?
I love that our past Surgeon General, Vivek Murtry, what's the biggest plague we have? It's not cancer, it's loneliness. And I just thought, what a perceptive human being that he would pick that. Because it is true. And when you sit and spend an hour with a patient and you can feel the loneliness coming out, and they don't know that, they haven't identified it yet, right? And so I do think it's a huge part of health. I will sometimes joke saying you can eat really well, but if you're not connected to anybody, and you want to be connected, some people are more solitary, but I think everyone needs some connection, then it's better to eat fast food and get connected. Because it just seems to have a big part of our existence.
Yeah, I think it got just so exacerbated in the pandemic, clearly, with people feeling really isolated and lonely, and some trouble reforming those connections that happened before. I think that's been a real issue. And even I have some people who are almost became scared of connecting with people after it.
Yeah,
Yes.
definitely.
Yeah. What's your take? What do you think about the role of community, connection, spirituality, joy, play?
Yeah, I think honestly it should really be the center of all the things that we're talking about, because if we're optimizing everything else, okay, so we have your body and your mind is perfectly optimized. What does it mean if you're not happy with others, or happy, even if it's, one or two really strong connections? What is living if you're not connecting with people beyond just yourself? So I think it's huge, and I think that there's a lot of evidence. We always go back to the evidence. There's a lot of evidence that social connection or having a spiritual practice really does impact mental health levels, just overall just health optimization and a lot of different things. And I think spirituality is incorporated into a lot of things that people do that they don't realize, like even journaling or meditating, yoga, things like that. So I think it really should be central to health, and I think that it's something that we don't talk about as much in healthcare, which I think it should be.
Yeah, I think even, in my own visits, sometimes people, it can get really focused on diet and supplements and lifestyle and these questions that are so present. But I love that idea that it should be the center of that, and play and creativity and all these kinds of things. I think are things that we don't emphasize enough. Yeah, couldn't agree more. That's why we're all here together on this Integrative Medicine Day.
Yes. And good to be in person, even though it's negative 10 degrees outside.
Exactly, with a wind chill of negative 28 degrees. Yes,
right.
But still cozy, and it warms my
Yeah.
heart to be with you guys
Yeah, I agree.
because
Yeah.
we're usually not all in the same room. So this is, you can feel the energy flowing here, the positive energy.
We don't want this to end. We want to keep
No,
going.
it's going to keep going. We're supposed to end in like 2 minutes, but we just want to keep going. Well, I think with that, I'll just let us wrap up and thank my wonderful friends and colleagues, Dr. Mariella Wood, Dr. Lori Walsh, for joining me for Integrative Medicine. Ask Me Anything Today with the Osher Center for Integrative Health at Northwestern University. We have a fabulous team at our clinic that provides integrative medicine consults, chiropractic, massage, and body work, acupuncture, health psychology, nutrition, and health classes, and really like a team that brings the science, the expertise, and the connection and heart too. So take advantage of that. And we have our university team with our researchers and educators. So we are just thrilled to thinking about this idea of community, to have our family of people who share our beliefs that, we want to bring more healing to the world. So thanks again for joining me. Thank you for joining us today.
Thank you.
Thank you.